Last week, the UK announced that they were going to do the world's first human challenge study on COVID-19. Um, so, what a human challenge trial is the way that vaccine studies have been done so far is you take large numbers of people and the trials involved about 40,000 people. So you give 20,000 of them the vaccine and 20,000 of them you give them the placebo. And then you just wait to see how many of them naturally get COVID-19. And that's why you have to get so many people and watch them for a long time because the chance that any one person gets COVID-19 is pretty low. So that's why they need to have such large numbers. Another way of doing a vaccine trial is by doing what's called a challenge trial. And in this one, you can just get a far fewer number of people, and you don't even necessarily need a placebo arm because you just test. You give a small number of people the vaccine and then you expose them on purpose to the virus and see if they will contract the virus. And if you expose these people to the virus and they don't get they don't get the disease, then you figure that the vaccine is working. So they are going to do this, and what they're looking for is up to 90 volunteers age 18 to 30. And you'll notice that they've picked healthy volunteers 18 to 30 because this is the group that is least likely to have any bad side effects from the disease. So the death rate in this group is extremely low. In this group, it's probably lower than for the flu even, and the chance that something bad happens to them because they definitely don't want to harm anyone, and so they go through here and they talk about how this allows for a much faster testing of vaccines and treatments, but it is something that that they know is dangerous, and so they want to minimize the risk as much as possible. And the way they're going to do that is going to choose volunteers that are young and healthy. And so they said, if you want to know more, go to this website. So I went to this website, and you say learn more, and really it doesn't tell you too much other than that they're using a challenge virus. And the group that's running the challenge trial has run similar challenge trials used in influenza, rhinovirus, respiratory syncytial virus. These are all kind of respiratory viruses. None of these are as dangerous as COVID-19, but they do have some experience in this. And human challenge trials have been used in the setting of malaria, typhoid, cholera, those kinds of things, and especially for diseases like cholera, which is a kind of a waterborne disease. It's hard to know when there's going to be an outbreak and who's going to be exposed. So it's very difficult to run a natural vaccine study on cholera, and so they've done challenge trials on cholera too. I found this paper talking about the history of human challenge studies, which is very interesting. And it talks about Edward Jenner. And Edward Jenner is one of the pioneers of vaccination. And what he did is he noticed that nursemaids who got cowpox did not get smallpox. So it was called variolation. And so what he did is he actually took I think one of his workers' sons. Let me see if I can find it, if they talk about it. Well, he took a boy and purposely inoculated him with cowpox to see if that would protect him against smallpox. And then he exposed that boy to smallpox and found out that he did not get infected with smallpox. And so that was kind of one of the first human challenge trials. Probably not done with informed consent, and I'm sure the boy didn't know what was going on. And I don't know if the boy's parents gave consent. Luckily, worked out well in that case. The boy did fine and was protected from smallpox. But over the years, they were doing lots of challenge trials, and there was a lot of very unethical things going on. You know, back in 1897, there was an Italian physician in Uruguay who basically isolated the bacterial cause of yellow fever what he thought was the bacterial cause of yellow fever. Now we know it's a virus. And he injected the culture into 5 hospitalized patients. We don't know if he got their consent or their knowledge. 3 of them died. William Osler, who is a very famous physician, he said back then to deliberately inject a poison of known high degree of virulency into a human being, unless you obtain that man's sanction, is not ridiculous. It is criminal. And that's absolutely true. I mean, you cannot expose people to pathogens without their knowledge, at least. And so, during World War II, World War One, more people were dying from yellow fever. Soldiers were dying from yellow fever than from actual warfare. And Walter Reed that Walter Reed Hospital is named after, was a Army physician at that time, and he was asked to figure out how yellow fever was spreading. There was a suspicion that yellow fever was spreading through mosquitoes, and so he basically asked volunteers to sign a contract where he paid them $100, which is equivalent to about $3,000 in today's money. And it was doubled if they actually contracted yellow fever. And what they did is they would have mosquitoes bite patients that had yellow fever, and then have these volunteers get bitten by those same mosquitoes. And by that, they figured out that mosquitoes were indeed the cause of this. And then similar challenge trials were done in malaria. The difference in the COVID-19 challenge trial versus things like cholera or malaria is that we have very good treatments for cholera and malaria and a lot of these other diseases that people are getting challenge trials from. So if they are to contract it, we can fairly easily and effectively treat them. For COVID-19, there is no really good known treatment for it. And luckily, in the group that they're exposing, 18 to 30, most of them are going to do fine with no treatment, the vast majority of them. So it is probably fairly safe, and obviously they've undergone ethics studies to make sure that they're not unnecessarily exposing people to harm. All I could find on what they're doing is this paper in Nature from October of last year, and basically their initial phase is dose testing. What they're going to do is they're going to get these participants, and they're going to expose them to increasing doses of the virus and see what dose of virus is needed to actually get them to contract the disease. That will be somewhat important to know, and all I could figure out from all the newspaper articles that I found, because there was no specific scientific information on the protocol, is that they're planning on using the original variant as the challenge virus, which makes sense because the original variant is the one that's the most well characterized in terms of clinical outcome. So if you want to reduce the risk, you would use the original variant. But that kind of limits how useful this study is going to be, because a lot of things that we want to know are based on the new variants. I mean, we want to know how infectious is it? Do the vaccines work against the new variants? These are the questions that using the old variant will not be able to answer in a challenge trial. And then them limiting it to the younger, healthier patients means that their results may not be applicable to the people that we really need to protect. The people we need to protect are unhealthy and older people, and who knows if they get infected with less virus, and who knows if they respond differently to the challenge. And vaccine and treatment results from this younger population may not be transferable to an older, unhealthier population. So it's unclear how useful the information that can be gained from a human challenge trial like this is going to be, but they are going to move forward with it, and hopefully no one has any bad outcomes from it. I think knowing the effective dose of that virus will be important and could be useful information, and rapid testing of vaccines through a challenge trial, if they can do it safely, is very helpful. But I just don't know how transferable it will be to the new variants, and how transferable it will be to an older and unhealthier population.